Hello, this is Taekyung Kim. Today I'd like to talk about Lyme disease and the inflammation on heart. Lyme disease is a bacterial infection by Borrelia. It can be best treated in the early stages. Treatment for early localized disease is a simple 10 to 14-day course of oral antibiotics to eliminate the infection. It normally takes 28 days to 3 months to get rid of the infection. If people are treated for Lyme disease with antibiotics but continue to experience symptoms, it is referred to as Post Lyme Disease Syndrome or post-treatment Lyme disease syndrome. About 10 to 20% of the people with Lyme disease experience this syndrome, but doctors and scientists still do not clearly know why. Sometimes the people who have post-Lyme disease syndrome complain about stabbing pain on their chest area. The pain begins in the center of the chest and radiates to the neck or upper back. Quite often, this kind of pain seems to be caused by the pericarditis. Pericarditis is an inflammation of the lining surrounding the heart. The heart muscle has a tight covering that surrounds it, a lining sac called the pericardium. This sac actually has two layers. The visceral pericardium is only one cell layer thick and fits tightly onto the heart muscle. The parietal pericardium is much tougher and thicker and has fibers that fasten the heart to the ribcage and diaphragm. There is a potential space between the layers, meaning that in normal situations it has a minimal amount of fluid. However, when the inflammation occurs, it can fill with fluid. This increased fluid in between the layers increases the pressure and can cause pain on the chest. About the people who have post-Lyme disease syndrome, the inflammation on heart layer occurs due to the error of their immune system, which is massively shocked by the bacterial infection. This huge shock created by the bacterial infection makes their immune system confused and become hypersensitive, and it starts to overreact excessively. In consequence, it can cause a high level of inflammation anywhere in our body. When the outer layer of the heart is inflamed, people can suffer from many kinds of symptoms, such as sharp or piercing chest pain, more intense pain while breathing, shortness of breath, heart palpitations, low-grade fever, an overall sense of weakness and fatigue, cough, feeling sick, abdominal or leg swelling, etc. To get rid of the inflammation on the heart, firstly, people need to eat right diet for their own body type. All the human beings are divided into 8 different body types in 8 constitutional therapy. People with each body type should follow the specific group of diet. When the people eat the right diet for their own body type, all their internal organs are well balanced, and this optimizes the internal organs. These optimized internal organs are working their best. This can maximize the healing potential of our body. Secondly, people have to eat each meal on time and the same amount every day. This makes the stomach strong. The stomach is the first line of the nutrition factory of our body. Therefore, when the stomach gets stronger, then people can absorb more nutrition from what they eat. The increased nutrition can accelerate the healing process. Finally, people are supposed to take regular treatment sessions. According to my clinical experiences, 8 constitutional acupuncture could be one of the best clinical methods to remove the inflammation on heart. Thanks for watching this video.